When the pandemic hit, our lives turned upside down and everything changed. But how many of those changes will stay with us? We're exploring what to expect next year and everything from education to travel. And we start with the pandemic itself. Dr. Celine Gounder is a member of President-elect Biden's COVID-19 advisory board. She's an epidemiologist and infectious disease expert at the NYU Grossman School of Medicine and Bellevue Hospital in New York City. Dr. Gounder, good morning.
Good morning.
So let me read for our audience something President-elect Biden said yesterday. He said, quote, at least 1 million vaccines, our darkest days in the battle against COVID-19 are ahead of us, not behind us. So what are the biggest challenges we face in the year ahead?
Well, I think just in the coming month, we are very concerned about the fact that hospitals, ICUs are currently full. Doctors and nurses are burned out. They've been fighting this for months now. We are experiencing the results of the Thanksgiving surge, and now people are traveling for Christmas and New Year's. And so I think we're all really panicking about what it is that we're going to do on the front lines in hospitals to take care of all these patients. You have some staff that are just saying, look, I'm fed up, I'm quitting. I can't do this anymore. And there's not really, you can't Defense Production Act your way out of a shortage of healthcare providers. You can play maybe a little bit around the margins with bringing people back in from retirement or promoting medical students to first-year intern status, but that's not nearly enough to meet the surging needs right now. So if there's any time I would say to people, please do not travel, this is the time, and this emergence of a new variant makes that even more urgent.
Well, the president-elect, as you know, Dr. Gounder, says at least 1 million vaccines a day he wants to see in the first 100 days of his term. Is that possible?
Well, we're certainly going to have to ramp up vaccination and do many more vaccinations per day. In the first week or so, we did not get to 1 million vaccinations. We need to be doing 1 million vaccinations per day to be getting to the targets that the president-elect has outlined. So that's really going to mean a massive increase. And again, when you have all of your doctors and nurses in the hospitals taking care of sick patients, who's going to give those vaccinations? So we really have a massive manpower problem right now.
Dr. Gounder, we spoke earlier this morning with Dr. Tom Frieden, who said it's so important for people to continue wearing those masks, and he sees that happening for the next several months. But do you see a future in the next 6 months to a year where we won't be wearing a mask, or is this sort of the new normal for some time?
I think, unfortunately, this is the new normal for some time. I think 6 months would be very optimistic. I don't think we're going to have everybody vaccinated by then. And I think it's really important for people to understand that even once you have been vaccinated, we do not know that you can't still get infected and transmit to other people. All we know is that the vaccine will prevent you from getting severely ill and from dying. And so even once you are vaccinated, it is really crucial that you continue to wear a mask in order to help contain this. And, I can tell you, I'm going to be vaccinated later this morning myself. I will continue to wear a mask.
So, Dr. Gounder, for the American people who want to know the priorities of the president-elect's administration when it comes to battling the coronavirus, lay it down for us. What do you expect to see over the next year?
Well, I think you're going to see a massive increase in testing. It is really hard to contain something when you don't know what you're even dealing with. So it's like a big iceberg. We see the very tip of the iceberg, which is the people who are getting severely ill, ending up in hospitals and dying. But we don't see that massive part of the iceberg that is underwater, which is all of the people getting infected and transmitting onward. So the only way to reveal that invisible part of the iceberg is by doing massively more testing. The other thing that this variant, the emergence of this variant has highlighted is the fact that we are not doing enough what we call genomic surveillance. So that's not the regular testing that you do when somebody thinks they may have coronavirus. That is much more intense testing to look at the genome, the genetics of that virus to see if it's mutating. And we do not routinely do that. The United Kingdom has already sequenced almost 4,000 separate strains of the coronavirus. We have done barely 40. So we're not doing nearly enough of this kind of surveillance testing as we need to be doing.
All right, Dr. Gounder, as always, we thank you very much. Appreciate it.